We've heard of IVF, we've heard of surrogacy. Surrogate motherhood is on the rise. What really is surrogate mother?
Good question.
And on this program, we took you through the process of IVF. Today, we take you through the process of IVF. And on that program, we talked about sperm bank. You are welcome to the andrology lab, one of the many tables that the egg and the sperm will have to pass through. Which are the ones that you put here in this?
These are liquid nitrogen tank for cryopreservation of sperm and embryos.
Is there any way
This particular one is sperm tank. So like this sperm, I can preserve it for as many years as possible. So far, the liquid nitrogen is not completely dry up. Weekly, I top the liquid nitrogen to keep it in level. When I dip it here like this, the temperature of liquid nitrogen is about minus 186 degrees Celsius.
Yes.
So at that temperature, the sperm will be viable as long as 10, 20 or more years.
Well, if there's a sperm bank, it means there are sperm donors and there are egg donors. So today we're going to be talking about sperm donation and egg donation, what it entails, and how people go about it. We're going to talk about freezing your eggs and much more. And to do that, I have the foremost fertility expert and pioneer of IVF technology in Africa, President African Fertility Society, and the Chief Medical Director of Medical Arts Center, Professor Oladapo Ashiru. Prof, thank you. Thank you so much. Always coming to empower us with information.
Pleasure to be here.
Yes, thank you. Yes, you're welcome. And today we're going to be talking about sperm and egg donation. Prof, my question is going to be double-barreled. Abroad, people donate sperm, they donate eggs. There are women who've gone past menopause who can no longer produce eggs. So most of them depend on egg donors. And men who have infertility problems, they also depend on sperm donation. In Nigeria, do we have such? In some countries, people donate sperm free of charge, just like they donate blood. In some countries, they pay. What is it like in Nigeria?
In Nigeria also have sperm donation and sperm bank. Because the professionals in this field of assisted reproductive technology in Nigeria have been trained from abroad, either from America, someone like myself, or from Europe or from England. So invariably, we follow the guidelines that are applicable in most of these centers. And since 2016,
Yes.
we have a set of approved guidelines in Nigeria that controls assisted reproductive technology.
Yes.
So essentially, we follow the principles that operate in most of those countries and also here. What do we mean by that?
Yes.
Many of us in this field, we came together under the auspices of the International Federation of Fertility Society and the World Health Organization. And we say that having a baby is a human right. And that is as a follow-up to United Nations Charter, that infertility or fertility has to be removed from the environment. So all infrastructure must be provided to help them. And one of them is donor of gametes. So therefore, countries that operate donor gametes must have the support to do so. What is the first criteria for donor gamete? There must be those who are willing to donate. And you talked about compensation.
Yes.
We have now agreed universally that you cannot give money for donation of gametes. However, you can give what you would refer to as remuneration or compensation just for the, maybe for transport or for the inconvenience allowance and things like that. But it is not for sale.
Okay.
And that has been the overall umbrella. And therefore, you see that some people give it for free, and in places like United States of America, people pay, they are paid as much as
$1,500.
even if you go to a place like Johns Hopkins or Harvard, and you want people there to donate gametes for you, like eggs, they pay up to $6,000. Yes.
When people come to donate, I know that abroad, there's always a criteria you have to meet to donate.
Absolutely.
There are some women who go and they say, I want the sperm of a tall, dark, and handsome. There are some who say, I want the IQ, the genius sperm. In Nigeria, do we have the criteria, or do people come to you and say, this is what I want? And when people come to donate, do you ask them to bring their personal data where you have to know about these things? If they are criminals, if they are suffering from one sickness or the other, and will they be truthful enough to say these things?
Now, this is the criteria for having a bank.
Okay.
You have a series of questionnaires that they fill. So they must be physically fit. So they must have no disability, not just in physical, by the blood analysis. Somebody that has a carrier of a genetic disorder cannot be a donor. Somebody that has blood-borne diseases cannot be a donor. By that I mean infection, starting from even syphilis, or now going to the more complicated one like HIV or hepatitis B or any of those viral infections. You cannot be a donor. Then you go to the next level in terms of the blood group. There are some blood groups like rhesus factor. They cannot donate eggs or sperm. Then you go to the next level in terms of any genetic diseases in the family. Even though they may not identify, but you can see from their own physical traits or in the blood analysis if there are. And the next level of screening is in terms of their IQ. So they must be, usually most of them are university or technical university students, or sometimes people who donate for their family. So, and in those ones, we ensure that they have good academic standing by the way they answer those questions. And those questions have been so designed, like those that test IQ of people.
Hold the thought. Hold the thought. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, we are talking today on sperm and egg donation. Prof, what is the Full Fertility Federation doing about using the same sperm for various women, which will result in the children being brothers, sisters?
Yes.
And how do they get to bring them together to know themselves so that they don't intermarry?
Okay, now, first of all, before you use a sperm, when the particular person have tested normal to all the various parameters, and these parameters are not set by the Nigerian professionals, they are international parameters that are set globally acceptable. You keep the sperm frozen for a minimum of 6 months. And you now get to see the person again. So the donor must come back again after 6 months. And then you will verify and you will certify those information. When they clear your parameters at that point, then they pass the test. And those sperms will move from quarantine storage into the bank. So you cannot use a sperm that is
just freshly
under
donated.
quarantine for somebody. The sperm, the true best practice is that those sperm must be stored for at least 6 months, and then they go into the bank. And they are all numbered, and they have what we call a multiple numbering system. That is, you know the person, you know the height, you know the weight, you know the complexion, you know the academic background, basically, and you know the blood group and so many other profiles like that, so that you can always match that individual. And beyond that, you have the number of times that sperm is used. And the cup-up is usually between 5 to 10, no more. And after that, because that you can no longer use that specimen. But let me also back up that before a person is given the option of a donor sperm, I think I must emphasize here that donor sperm, or therapeutic insemination as it is called, it's not really donor sperm, it's therapeutic insemination. Why is it therapeutic? The husband or the partner has been given the maximum chance to have his own sperm coming out.
And
the
then
maximum chance include medication, and also to emphasize clearly now that the recent review has now shown that the parameters that are creating this problem that require therapeutic insemination are parameters such as things in the environment, like occupational hazard in the oil and gas industry, where the excess oil forces in the environment, like in the oil producing area, like in the rig, have damaged the sperm. Some of the studies I have done with some of my students who underwent PhD program showed that those things are there. Under this type of criteria, you then have other exposures like those who work in the paint industry and things like that, which I've explained in earlier program. Yes. So when these things happen, now we know that if they go through some series of detoxification and medication, you might be able to get them to have those sperms coming out usable for IVF ICSI. And if that does not happen, you still give them another extra chance by going into the testes, looking either to the epididymis to extract the sperm, or actually going inside the testes to find out whether you can aspirate sperm, or actually cutting the testes and taking a tissue out and checking it under the microscope to see. And we are, in some cases, we've been able to find just 1 or 2 sperm and fertilize just 2 oocytes and transfer maybe just 1 embryo to the patient, and the woman became pregnant and had a baby. So when you have exhausted all that and you know that there is no option than either to have no child or to adopt, then you get the couple involved in therapeutic insemination. So you can choose somebody that has the same blood group as the husband, the same height, the same complexion. And because I would say that by thought process, because the couple, they are involved in that process, they are part of that conception. And we have found out that the outlook is better, even in the baby.
Hold the thought, Prof. Hold that thought, Prof. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us in these remaining moments, we're still talking about egg sperm donation. Now, Prof, I still come back to that same question I asked you, where you said that a sperm can be used like 5 or 10 times.
Yeah.
That 5 or 10 times, within what radius? Because you're talking about brother and sister.
Yes.
Or sister, brother, and brother.
Yes.
So what do you do in that case?
Most likely, we try to do some ethnic balancing also in this country for sperm selection, so that we will not give this sperm from one ethnic group to another ethnic group. And we try to do that. And in our center, I don't believe that any particular donor has been used for more than 3 times. So we try as much as possible to balance it. And there is also some geographical calculation that we have to make sure that it's not in there. However, there is a flaw that we're trying to, which you cannot control, either in this country or abroad. The only difference is that abroad they have more, the sperm banks are actually individual separate clinics. Unfortunately, we have not evolved enough in this country we don't do that many IVF altogether in this country in order to have somebody that will open a clinic or a center only for the purpose of sperm bank, for the sperm or for the egg. Hopefully, I'm sure that maybe 10 years from now, when the technology has increased, then maybe some of the people will just say, okay, all they want is to open a sperm bank. Like the cryobank in the US is just a bank that just collects sperms and pay people for it, and they store it, and clinics
need sperm and they go there
for them, for the sperm or for the egg, and store eggs just as sperm. Apart from patients who opt to store their own eggs for themselves. At the end of the day, what should guide the clinic is respect for human dignity and for mankind, and not to really, you should not there should be a lot of ethics involved, and you should be careful that what you are doing is not an overkill. You don't just do it for the sake of doing. If you have not found the right gamete, let the person wait for an extra 2 or 3 months before you get the right one, and don't rush it. And also, try as much as possible to ensure that you have exhausted all that option to help the couple to have children of their own. And when there is no other option but that, make sure you have gone through extreme due process in selecting those who will donate the gametes. And in our experience, when that baby is born, the couple, they're usually very happy that they went through it. No one has ever regretted going through that process. Yes.
The eggs and the sperm, what's the longest? Because now people are delaying having children, freezing their eggs and their sperm, right? Until when they are ready. How long can the egg and the sperm, how long can it be frozen for?
They can stay in the bank indefinitely.
Indefinitely?
Yes. All gametes and even the embryo, they can stay in the bank indefinitely. We have people who we have a number of patients who have 3 children now, but from an IVF that was done about maybe 4 years ago, they had the first child. Then another year and a half, they came for the second one, and they came back to the bank for the third one. And sometimes there are some legal issues involved, in the sense that a couple which is globally, a couple will go and have IVF treatment. They will have the embryos in the bank, and then maybe somewhere along the line, one of the couple dies.
Okay, right.
And then the other one
decides to go and
have either to take the embryo for herself, or the husband, now the wife has died, wants to take the embryo for another person. It is not acceptable.
Oh, it's not acceptable.
Yes, unless you get the consent
of the other partner.
And before
he dies or she dies.
Yes, yes. The world is changing with advancement in technology that has now become more familiar with us. When those technologies were not very familiar, there was hostility and resistance and resentment.
Yes.
And the more they are, the more they've accepted it. And on that note, I will tell you that even the men, the minute there was ICSI,
we prepare the dishes, we put our sperm, and then we put our egg, and then we move down to the ICSI rig. That's where we
down to where?
The ICSI rig.
ICSI
is intracytoplasmic sperm injection.
ICSI rig.
In layman terms, this is where we do the egg insemination.
Thank you very much.
You're welcome, madam.
Now, viewers, that's the embryology lab. We now move to the ICSI. Hello, Ekemini, how are you?
I'm fine, thank you very much.
Okay, what exactly do you do here?
Okay, precisely after the andrologist have washed the sperm,
Okay.
and the embryologist has also denuded the eggs,
Yes.
I have to sit down here and pick up each sperm and inject in each egg. So this is a moving sperm. So the first thing I get to do is I immobilize the sperm. After immobilization, I take the sperm to the egg droplet, and I inject in each egg. So this is me injecting the sperm into each egg. Okay, so I am done with injection now.
they readily accepted it. Why they may not even have allowed their wife to go for donor And now they now accept ICSI as an option. Before they will resist IVF if they have normal sperm. That they have the sperm, but the woman doesn't have the egg, or the tubes are blocked, so it's her fault. So they don't want her to go through IVF. They don't want to give their sperm. But now that we develop ICSI for people with low sperm, they readily accepted it. So I'm just saying that for all of us, it is easy for us to accept revolution that occurs in science. And in fact, it's been predicted that the next revolution we have next to, after the IT revolution that we are all using now, is reproductive revolution. We're going to have reproductions of different types as science comes into fruition, that we may even take a cell from a man to grow the sperm. So we may not even require donor sperm again. And we may even take the cell from the woman to grow the egg. So what are we saying? That's technology. So get used to it. Stay tuned.
Prof, thank you so much. It's always a pleasure to have you come and empower us with information. I'm blown away. Thank you. Thank you. It's always an honor. I'm humbled.
It's a pleasure.
I'm humbled.
It's a pleasure to be
Don't
here.
go anywhere. We'll be right back. Everybody deserves to have a child. If you cannot, science has helped you. And for those who still feel that it shouldn't be, I always say to them, it's God who has given doctors the wisdom to come up with this, because it says, none amongst you shall be barren. Until I come your way another time, you have a wonderful week ahead of you. Goodbye, God bless, and see you again next week.